Kopyltsova here at the purchase office of ENT and Allergy Associates. Today I would like to talk to you about what causes cough and when to seek treatment. So cough can come from a lot of different places, and probably some of the most common scenario I see in my practice is cough coming from postnasal drip. So imagine if you have sinus issues or inflammation in your nose, you can actually experience consistent drip in the back of your throat. Some people describe it as a tickle, and for some people it can actually lead to recurrent cough. Another place to consider is certainly cough can come from your lungs. Remember, allergies can inflame your nose and lungs sometimes directly. And finally, a third place to consider is actually cough that's due to an acid reflux. So acid is only supposed to stay in the stomach, but sometimes it escapes through the tube called esophagus. It connects stomach to the throat, and so if the acid escapes, it can actually irritate the throat and lead to cough. When you come for your visit, we're going to consider all of these possibilities and see if your symptoms are consistent, for example, with a postnasal drip, in which case we might advise that you undergo some allergy testing to some of the common environmental allergies. The test can take up to 20 minutes, and it's a scratch-based test where we identify whether or not environmental allergies play a role in this presentation. If necessary, we can also do lung function tests, and they can show us your lung volumes. There's a special test called nitric oxide test. It can actually help us determine if there's inflammation that's going on in your airways. That can oftentimes be helpful. So you will have an answer by the end of the session whether there are environmental allergies that play a role in your symptoms. We also will be able to do some lung function testing and get a better understanding of your lung volumes. If necessary, we'll do that nitric oxide, the inflammation test. It can actually detect inflammation that's common in your airways and can be helpful to kind of narrow down the diagnosis. So cough that lingers for longer than 8 weeks is considered chronic. It can be one of the most common presenting complaints for folks who seek medical attention. So in the past, the thinking was that there's an upper airway and a lower airway. Upper would be domain of ENTs and lower would be domain of pulmonary specialists. Really, the way we're starting to think about this is inflammation can actually affect you from the nose all the way down. So folks who suffer with allergies can actually have symptoms in their nose and in their lungs. So if you're coughing, please consider getting yourself evaluated. If you have any questions at all, please feel free to call me. You can also call 1-855-ENT-DOC, or you can also book your appointment online.